The urinary system, part 2. Table of contents as usual. And we are starting physiology of urine formation. So our kidneys filter the body's entire blood plasma volume 60 times each day. So every particle of our blood goes through the kidneys 60 times every single day. A lot of work to do. There are 3 steps of urine formation in the kidneys: glomerular filtration, tubular reabsorption, and tubular secretion. All those 3 steps are happening right here in the nephron. We have more than 1 million of nephrons in each kidney, remember. The first step, glomerular filtration, it's when blood enters through the afferent arteriole into glomerulus, and because of the pressure in the glomerulus, water, also some ions, glucose, some waste products are forced from the glomerulus into the glomerular capsule. And that fluid that will be right here in the glomerular capsule right now is called glomerular filtrate. Our blood cells and large proteins in the blood, they cannot go through the walls of the glomerulus in the capsule. So all of them stay in the blood. They do not go into the capsule. Next process. We have a lot of filtrate right now, lots of fluid, and we cannot just lose all that water. We would be severely dehydrated. That's why we have step 2, tubular reabsorption. That filtrate that passes through the proximal distal convoluted tubules loop of Henle, and it's a lot of it, and 99% of it needs to be returned to the blood, usually through those peritubular capillaries. Here they are. Finally, by that time that fluid is going through the tubules, in the blood, there still will be some amount of substances we do not need. Some toxic substances, hydrogen ions, creatinine, drugs, they should be removed from the blood into the urine. And urine is being made in those tubules. So those toxic substances and wastes will be secreted from peritubular capillaries into the tubules, and that process is called tubular secretion. Secretion from the peritubular capillaries back into the filtrate in the tubules. So those are 3 main steps of urine formation. That was just a summary, and now we will talk about each of them in more details. And number 1 will be what is happening right here in the glomerular capsule, which is glomerular filtration. The walls of the capillaries right here are semi-permeable, so they can let water and small ion substances to go to the capsules. And the same is true about the walls of the Bowman's or glomerular capsule. Now you need to know what is renal fraction. The heart pumps about 5 liters of blood every minute under resting conditions, and approximately 1/5 of that, 20%, or it would be 1 liter of blood, enters the kidneys to be filtered, and it's called the renal blood flow. So 1/5 of the whole blood goes to the kidney. It's called renal fraction. And that blood that is going through the kidneys, it's called renal blood flow. On average, this results in the production of about 110 milliliters per minute of the filtrate. That is called glomerular filtration rate. So filtrate right here in the glomerular capsule is the fluid derived from blood flowing through the glomerulus across filtration membrane. So that membrane between the glomerulus and capsule wall is called filtration membrane. Most of that filtrate later will be reabsorbed back from the tubules into the blood, peritubular capillaries. So what is there in the filtrate? Water, of course. Some small molecules, like glucose for example, ions that can pass through the membrane. And do you think there will be any blood cells or proteins? No, I told you, again, blood cells or proteins cannot cross that wall and go into the glomerular capsule. What moves water from the capillaries right here, from the glomerulus into the capsule? Pressure difference. Right here in the glomerulus, pressure is higher. Average urine production will be 0.9 milliliters per minute, or in the whole day it would be 1,300 milliliters, or approximately from 1 to 2 liters of urine, depending on how much water we consume and how much water we lose with sweating and urine. Filtration membrane. So here it is, one of those capillaries in the glomerulus. They have fenestrations, so substances can cross their walls. That's the basement membrane, and that is called fenestrated endothelium of the glomerular capillaries. That endothelium with those fenestrations opening. Then there is gel-like basement membrane. And on the outside, right here, there will be podocyte cells sitting, podocytes. They have their food processes, and between the food processes, there will be filtration slits. So both the fenestrations, basement membrane, and filtration slits allow water and small substances to cross it and prevent blood cells and proteins from crossing it. Okay, so filtration membrane allows passage of water and solutes. They should be smaller than most plasma proteins. Fenestrations, here they are, prevent filtration of blood cells and plasma proteins. And those slit diaphragms right here also help to repel macromolecules, large molecules. What happens sometimes when for some reason it can be infection or it can be autoimmune process or physical damage, when glomerular capillaries are damaged, when their walls are broken, then it's a condition called glomerulonephritis, when both proteins and blood cells can go into the urine. So urine will have proteins in it, it will be foamy, and it will have blood, sometimes even visible blood. It changes its color and becomes reddish. That's a pretty dangerous condition, requires treatment. Blood hydrostatic pressure. Those afferent arterioles supplying blood to glomerular capsule, they bring both good substances, useful for us, and harmful substances. The useful substances would be glucose, amino acids, vitamins, hormones, electrolytes, ions, everything we need for well-being. The harmful substances that should be removed with urine would be metabolic wastes like urea, uric acids, creatinine, some ions we don't need, and also different toxins and drugs. Now, blood already arrives into those capillaries of the glomerulus under the pressure from aorta created by the heart. But also the diameter of afferent arterioles exiting right here is narrower than diameter of afferent arterioles entering. Due to this difference in diameter of arteries, blood leaving the glomerulus creates the pressure known as a blood hydrostatic pressure. It's 55 millimeters of mercury, and it pushes fluid through the membrane into the glomerular capsule. So filtration pressure is pressure responsible for filtration. It forces fluid from glomerular capillary across the membrane into the lumen of glomerular capsules. But there are three forces working here. We already said about one of them. That would be blood hydrostatic pressure, and it is 55 millimeters of mercury, moving fluid out of the capillary to the Bowman's capsule. Then, right here in the capsule, there is already some amount of filtrate, and it already creates some pressure just simply being there, by being there. That pressure is 15 millimeters of mercury, and it's called capsular hydrostatic pressure. Finally, right here in that fluid, in the filtrate, there are no proteins, but there are a lot of proteins in the glomerular capillaries. And by osmosis, proteins creating osmotic pressure will be attracting water from the capsule back into the glomerulus. That is called blood colloid osmotic pressure, and it's equal to 30 millimeters of mercury. So what's the total sum of all those pressures working in opposite directions? It's called net filtration pressure. So 55 minus 15 plus 30. And as a result, we receive our net filtration pressure, 10 millimeters of mercury, pushing fluid into the capsule, into the filtrate, and later through the tubules. Regulation of glomerular filtration rate. Kidneys can regulate it by themselves. And as soon as our blood pressure increases, our kidneys receptors can feel it, and the afferent arterioles constrict using their smooth muscles and prevent increase in renal blood flow. So less blood goes to the glomerulus and glomerular filtration rate decreases. Next one, our central nervous system can regulate it through the sympathetic stimulation using norepinephrine, a hormone produced in the adrenal glands above the kidneys. Norepinephrine can constrict small arteries and afferent arterioles too, same mechanism. So that decreases renal blood flow and filtrate formation decreases. It happens usually during shock or intense exercise. Before you continue, please stop the video and answer the questions for part 2.1. Tubular reabsorption. Now we will be talking what happens right here in the tubules of the nephron. Tubular reabsorption happens as filtrate produced right here flows through the lumen of the tubules, proximal, loop of Henle, and distal convoluted tubules and collecting ducts. Substances that are transported to interstitial fluid and reabsorbed into peritubular capillaries. Remember, peritubular capillaries are blood vessels right here, and we also have vasa recta going down along those loops of Henle. So inorganic salts are reabsorbed. Organic molecules like glucose and amino acids and water. 99% of the filtrate volume will be returned back to the bloodstream. So these substances return to general circulation through the venous system because both vasa recta and peritubular capillaries enter the veins. Peritubular reabsorption. Nutrients such as glucose, right here, amino acids, vitamins, and positively charged ions will be reabsorbed by active transport, which means using ATP energy, while negative charged ions and water will be transported by passive transport. For negative ions, it will be diffusion. For water, it will be osmosis. Now a little bit more details about what happens right here, what is called in proximal convoluted tubules. Those substances that will be reabsorbed, retained by the body, would be sodium, potassium, chloride, glucose, amino acids, and water. About 65% of water will be reabsorbed here by osmosis. When people suffer from diabetes and that diabetes is not controlled by medicines, then the concentration of glucose in their blood plasma will be high, and so it will be in the filtrate right here. And high concentration of glucose in filtrate exceeds rate of transport, and that's why water is retained and the amount of urine increases. So those people will be losing a lot of water, they will be dehydrated, and they will be thirsty all the time. Those are symptoms of diabetes. Reabsorption in loop of Henle. Going down right here, descending thin segment is permeable to water. About 15% of water is reabsorbed right here from the thin tubule into the vasa recta. What about ascending segment? It is not permeable to water, but it's permeable to solutes like sodium, potassium, chloride, and they diffuse out of the tubules in the descending vasa recta. Reabsorption in distal convoluted tubule and the collecting duct. Mostly it's water, not only but water. Water will be moving as osmosis, and permeability to water in these places is variable because it depends on the presence or absence of antidiuretic hormone. Please right now take time and remember how exactly antidiuretic hormone works with the collecting duct. Antidiuretic hormone is responsible for some proteins, how those proteins function. Proteins just for water. Please remember their name. So when production of antidiuretic hormone declines, the urine volume increases. And depending on the amount of antidiuretic hormone, urine can vary in concentration from low volume of high concentration to high volume of low concentration. Tubular secretion happens all over the tubules of nephron, and it moves metabolic byproducts, different drugs, and molecules that are not normally produced by the body from the blood in those peritubular capillaries into the tubules of nephron. Here it is: urea, uric acid, creatinine, some drugs, urea, hydrogen, potassium. With such a creatinine or excess ions like hydrogen or potassium, also some drugs like penicillin and aspirin will be actively secreted into the nephron using ATP energy. Tubular secretion of hydrogen ions is very important in maintaining of normal pH of the blood. So that's why one of the functions of the kidneys is to maintain blood pH. Remember the normal blood pH? The tubular filtrate, finally, right here, when it's going down through the collecting tubules, collecting ducts, is known as urine. Before you continue, please stop the video and answer the questions for part 2.2. Blood flow through the kidneys can be regulated by several ways, and one of them through the sympathetic nervous system. Sympathetic stimulation causes constriction of afferent arterioles. It means less blood will be flowing through the kidneys and less urine will be produced. Next one. Endocrine system also regulates a kidney function. Kidneys produce renin, and renin converts angiotensin 1 into angiotensin 2. Remember that. Angiotensin 2, one of its functions is stimulating adrenal cortex to produce aldosterone. And aldosterone is a hormone that promotes sodium reabsorption. When sodium is reabsorbed in the tubules, it promotes water reabsorption from the tubules into the blood, back to the blood. It means it decreases urine volume, water stays in the body, blood volume increases, and that increases blood pressure. Now, antidiuretic hormone. Mostly it works with collecting ducts. And antidiuretic hormone, when it's present, it helps cells right here in the collecting ducts to insert new aquaporins and open them. Aquaporins are proteins that help with water reabsorption. So in the presence of ADH, the collecting duct has a lot of those aquaporins, and it becomes permeable to water. Water is reabsorbed back into interstitial fluid, then it goes back to the blood. As a result, amount of urine decreases, but it becomes concentrated. What happens with blood pressure? It increases. So you need to know what happens with urine and what happens with blood pressure in the presence and in absence of antidiuretic hormone. In the absence of the antidiuretic hormone, there won't be so many aquaporins in the walls of the collecting duct, so much more urine will be produced, and that urine will be dilute. It won't be concentrated. Since the body loses a lot of fluid, blood pressure decreases. One more hormone that works with blood pressure and urine volume is atrial natriuretic hormone. It's produced by the cells of the heart, mostly by right atrium of the heart. When blood pressure is high, the walls of right atrium are overstretched, and the heart starts producing atrial natriuretic hormone. It inhibits reabsorption of sodium and inhibits antidiuretic hormone production. In the absence of antidiuretic production, volume of urine increases. Body starts losing more water. That decreases blood pressure. It makes it easier for the heart to function. To regulate our blood volume, we need to know our blood pressure, because our body cannot directly measure blood volume, but it can measure blood pressure. And when blood pressure is high, it usually means that blood volume is high also. In our aorta and carotid sinuses, there are baroreceptors, and baroreceptors can feel blood pressure. They send signals to the central nervous system. So when blood pressure increases, the central nervous system causes vasodilation, making our blood vessels wider, including vasodilation of the afferent arterioles. As a result, increased glomerular filtration rate causes water loss by the kidneys, and blood pressure decreases, returns back to normal. When blood pressure decreases, when it's lower, then fewer action potentials will be sent by the central nervous system, and it causes vasoconstriction. As a result, glomerular filtration rate decreases, and our body loses more water with urine. That increases blood pressure because volume increases. Please, before you continue, answer the questions for Chapter 25, Part 2.3. Diuretics are chemicals that increase urine output. So when we produce more urine, blood volume decreases. What happens with blood pressure? Right, blood pressure decreases too. That's why diuretics are used in hypertension, in treatment of hypertension and also some heart problems, for example, congestive heart failure. Some of the substances that we take on regular basis, even foods, they also can work as diuretics. Example, caffeine. It causes vasodilation in the nephron and increases glomerular filtration rate and urine volume. Alcohol also can increase our urine output, but it works in a different way. It inhibits antidiuretic hormone. As a result, tubular reabsorption decreases and we produce more urine. The urinary system and homeostasis. Well, urinary system take part in many homeostatic mechanisms, like maintaining blood pH, for example. Also, vitamin D synthesis. Vitamin D precursor is produced in the skin, but for it to become active, it must undergo what is called hydroxylation reaction in the kidney. When vitamin D is activated, it's important for absorption of calcium. So if kidneys do not work well, vitamin D will not be activated and we will not receive enough of calcium even if we consume enough of it. And when we don't have enough of calcium, that can cause diseases like osteoporosis, osteomalacia, rickets in children, and also different other problems, like problems with our muscles, with blood clotting, and with inflammatory response. Erythropoiesis. To produce red blood cells in the bone marrow must be stimulated by a special hormone, EPO, or erythropoietin. It is produced by the kidneys. And if for some reason we need more erythrocytes, red blood cells, when they are lost, it can happen because of the bleeding or underproduced urine disease, severe malnutrition. Kidneys produce more EPO and more red blood cells will be made. In case of renal failure, when kidneys do not produce EPO, it can cause anemia, and sometimes that anemia can be life-threatening. Finally, let's talk about blood pressure regulation one more time. So our kidneys produce renin, and that renin is a hormone taking part in a system called renin-angiotensin-aldosterone system. So liver produces substance called angiotensinogen into the blood. And when kidneys release renin, it happens when blood pressure is low, that renin turns angiotensinogen into angiotensin 1. A little bit later, lungs take part in the process also. They produce ACE, angiotensin converting enzyme, into the blood, and ACE converts angiotensin 1 into angiotensin 2. Angiotensin 2 has two functions. It raises blood pressure by causing a vasoconstriction all over the body, widespread vasoconstriction. The second function of angiotensin 2, it stimulates the adrenal cortex to produce more aldosterone. And aldosterone causes reabsorption of sodium. Water is reabsorbed after sodium, and retaining of water elevates and helps to maintain blood pressure. Please remember to answer questions for part 2.4.